Today, we actually celebrate the grand opening of Fulton County's first behavioral health crisis center. Now, before I go any further, this is the first, and the experts say that we need 3, but 1 is better than none, right? Yeah. So now this is always the toughest part when you have to make introductions, people who are here, elected officials in particular. So the list that I have been given, I hope I don't miss anybody. If I do, please forgive me. But first and foremost, our executive, well actually first and foremost, my colleagues, Vice Chair Khadijah Abdul Rahman, Commissioner Dana Barrett, Commissioner Bob Ellis, Commissioner Natalie Hall, who am I missing? Commissioner Bridget Thorne, and Commissioner-elect Mo Ivory. The executive team, our county manager, Dick Anderson, Chief Operating Officer for Health and Human Services, Dr. Pamela Rochelle, is not here. She's tending to some family matters. And also our Chief Financial Officer, Sharon Whitmore. Our state government partners, and thank you all for being here, because we would not be here but for state government, our partners in state government, in particular, Representative Jan Jones, Speaker Pro Tem Jan Jones, who really went to work for us. You're going to hear from Commissioner Tanner later. But state legislators who are here, Senator Josh McLaren, Senator Sonia Halpern, you'll hear from her, Representative Kim Schofield, Representative Derek Jackson, Mayor Tom Reed, Mayor Vince Williams, Mayor Andre Dickens, you'll hear from him shortly, City Council Member Antonio Lewis, Mayor Mario Avery is also here. Did I miss Commissioner Ellis? I got you already. Okay. Quickly, because it's going to get hot, but for far too long, mental health has been a problem for us and really been stigmatized. And we believe that this facility is going to turn that around. This facility was made possible through Fulton County investing $15 million in federal funds and the use of our Oak Hill facility, along with the state of Georgia contributing $9.4 million in annual operating funds. And because of our joint investment, our Fulton County residents will no longer have to struggle to find the resources they need. Fulton County as a government is committed to enhancing health equity and access in our community. Our investment in this behavioral health crisis center is part of our broader strategy to address health equity gaps in the central and southern portions of Fulton County. This facility is located just 1.5 miles from the now closed WellStar East Point Hospital. Now let us not forget how severely the closures of the 2 WellStar hospitals affected healthcare in this community. In 2023, a study was commissioned by Fulton County and the Morehouse School of Medicine, which demonstrated that the closures exacerbated existing health disparities affecting Black and brown communities. Opening this facility is part of our long-term strategy to fill the gap that was left by WellStar. And last but not least, I'd like to recognize from the White House, please stand, Ms. Neera Tanden, representing President Biden, who sends his regards, and we're delighted to have you here in the support of the White House. Now it's getting hot, and I know that our great mayor, our distinguished mayor, my friend, mayor of the great city of Atlanta, Mayor Andre Dickens.
This is a group project. Behavioral health, mental health, and all the challenges that we see across the region, across the state, across the nation, takes a concerted effort. And when you heard from Chairman Pitts talk about how federal dollars from the Biden-Harris White House comes down here to the county and also state putting in funding, and it's located in a city, that is showing the dynamics of the group project, of all of us working together to make sure we look out for our citizens, look out for our residents and their behavioral health. It is very important. So this Fulton County Behavioral Health Crisis Center is the first of its kind standalone center, and you said that we might need 3, and so this is one, and we're on our way to continue to figure out how we can do even more. So to the health professionals that are here, I see Dr. Paxton, I see others, to you all, thank you for always raising your voice saying we need more, and for making sure that we try to find a way to make that happen. So thank you, Fulton County, for your efforts in that, and for pushing this initiative forward on behalf of residents of Atlanta, residents of other cities in this area. So this facility will stand as a beacon of hope for individuals. Ultimately, it will save lives. And that's what it's all about. A 24/7 hub that will provide comprehensive services and holistic care for individuals experiencing issues related to homelessness. We know we have that. Individuals facing mental health challenges. We know we have that. Substance abuse. We know we have that, and more. So this place, in partnership with Grady Health System, man, where would we be without Grady, everybody? So thank you to Grady, especially with the closing of AMC World Star. So Grady has been chosen to operate this facility, and so we thank you all. So the Behavioral Health Crisis Center and the City of Atlanta's Diversion Center, which is also in partnership with Fulton County and Grady, we're going to get up to a ribbon cutting for that in a few months. And so the City of Atlanta and Fulton County government, no matter what you see on TV, we know how to work together and get things done. And so I stand here today very proud of working with you all and very proud of what's about to take place for our collective residents, for both the city, both the county, and the state of Georgia, and of course, for this White House that has put safety and mental health above all else.
I am Senator Sonia Halpern. I am a 26-year resident of Fulton County, and I am also the chair of the Fulton County delegation. So it is a profound privilege to stand before you today as we cut the ribbon on this facility that embodies hope, compassion, and progress. So today marks the beginning of something truly remarkable for the community. Strategically located off of Metropolitan Parkway, it is, as you've already heard, the first of its kind in Fulton County. But this is not just a building, it is a lifeline. And it stands as a testament to what we can achieve when we come together with leadership, vision, and a shared purpose, as we have in this case. So Georgia's largest county, I mean, imagine this, that this is the first of its kind in Georgia's largest county. But we are now poised to address a broad spectrum of mental health challenges, whether that's substance abuse crisis all the way to suicide prevention. Said another way, inside of this building, critical support will be provided to people in the most vulnerable moments of their lives. It's designed to be a sanctuary for those who need it the most, offering 24/7 crisis services in a safe and supportive environment. But more than that, it's a place where dignity is preserved and care is delivered without question of financial means. So when we broke ground just under a year ago, it was more than just a symbolic gesture. It was a commitment to prioritize mental health, to extend a helping hand to those in crisis, and to create a space where no one would be turned away. The funds from the America Rescue Plan, paired with support from the county and the state and the General Assembly, and of course the city, have made this promise a reality. And this is what partnership looks like. So many times I think we struggle to understand how different parts of government can work together to deliver good for the people. This is a great shining example of what happens when we get focused and locked in on a need, figure out what we all can bring to the table to make it happen, and here we go, the first of its kind in the county. So this is a step forward. Our work doesn't stop here, as you've already heard. We've all seen the devastating impacts of insufficient health investments and what that means. Mental health, I don't have to tell you I'm not going to tell you the statistics, but we all know that mental health is a challenge that touches just broadly. I mean, hardly anybody is not touched by issues around mental health, whether they are neighbors, colleagues, community members, or family members. Mental health services is crucial. So I just want to let you know I'm committed to continuing to work hand in hand with our county leaders to eliminate the barriers preventing our residents from accessing the essential health and mental services that they need, and extend great gratitude for everyone whose dedication and hard work played a role in bringing us to this moment. Together, we are making a profound and lasting difference in the lives of those who seek help here.
We know we need at least 2 more, Chairman. And so we hope this is the beginning of the work that needs to be done. All of us are at the table. And like Mayor Dickens said, it is a group project, but we know we need advocacy at every level. And I appreciate my colleagues, I appreciate those at the state and federally, and all of those in between, because behavioral health services sees no gender, it sees no zip code, it doesn't see party. And so I'm very happy to be here today to speak for those individuals who are struggling in silence and can now seek the help they need. This center will not only support those facing mental health challenges, but will also educate the community about the importance of mental well-being. We know in communities of color, we still deal with the taboo of seeking mental health. And we know just like we get a checkup for our physical health, we get a tune-up for our car, we definitely need service for our mental health. I thank all of you. I thank the chairman for his vision, and I also thank the county manager. County manager, without your leadership, I know at some point it looked like it was touch and go, but you stood in the gap and made sure by investing in mental health resources, Fulton County is not only addressing the current needs, but we're also laying the foundation for a healthier and more resilient community in the future. It takes all of us. Look around you. This is the village. And most importantly, I want to express my gratitude to the citizens of Fulton County for their support, their confidence. This is your tax dollars at work. And can we please celebrate and clap a warm welcome to Nira Tandy.
Thank you so much. Good morning, everyone. Good morning. I'm going to be brief because it is warm. Thank you so much for that incredible introduction, for your warmth and spirit and leadership that led to this beautiful, beautiful facility. I want to extend my thanks to Fulton County Chairman Pitts, Fulton County's leadership here, Chairman Pitts, the Georgia Department of Behavioral Health and Development Disabilities, the Grady Health System, Mayor Dickens for his phenomenal leadership, Senator Halpern, and the members of the community for welcoming me here today. I also want to say a special shout out to Antral Tyson from the Department of Health and Human Services, who oversees the region here today. And I'm just really here to say a few things. First and foremost, I am here to represent the President and Vice President and their gratitude for the leadership that developed this role model facility for the nation. They send their congratulations to everyone here for really building a facility and creating this location that, as I said, demonstrates Fulton County's understanding of the mental health crisis, but also its desire to step up and lead, not just here in Fulton County, not just here in Georgia, but again, for the country. So we are thrilled that American Rescue Plan dollars that the President and the previous Congress passed were able to help facilitate the funding of this behavioral health center. We recognize that mental health challenges are growing throughout the country, and we could describe it as a group project that builds support for this. But I used to work for Hillary Clinton, so I'll also say it takes a village. It takes a village of leaders at the local level, leaders at the city level, at the state level, and the federal level, and we are proud that the dollars passed by the American Rescue Plan have contributed to this. Overall, At the federal level, through the American Rescue Plan, communities have used $12 billion for mental health support around the country. But we are pleased to be here at this location that has the 24/7 services, the mobile unit that you see here, which is really state of the art in terms of going to people where they are. And I would just want to say on behalf of the president, who has made mental health issues part of his unity agenda, and also the vice president, who has made mental health equity a cornerstone of her healthcare agenda. The fact that we have the first, hopefully the first of three, but the first location here in this part of Fulton County, ensuring that we are delivering health services to everyone who needs them. Not just the people who are well connected, but everyone who needs them. That is a cornerstone of the Biden-Harris agenda, and it is that is one of the reasons why I wanted to be here today, because I think this is, again, a demonstration to the country of what we need to do to address mental health challenges, to bring services to where people are, and to go to where they are, not just in their neighborhoods, but really use mobile units to get services directly to their homes and facilities. I'll just say briefly that the president has a mental health agenda that's focused on care, coverage, and causes. And this location really demonstrates the care element, which is, as I said, a facility 24/7 with a variety of services for people who have long-term needs as well as short-term needs. And coverage is about getting people the care that they need where they are, as well as causes. So I just want to again express the gratitude of the president and the vice president for the leadership here in tackling this challenge and demonstrating for the country. If Fulton County can do it, other parts of the country can do it, and we will take this, your example, to the Congress and others about why we need additional support to actually tackle this challenge in every corner of the country.
The Georgia General Assembly allocated $9.4 million in the annual operating funds for this facility. You can clap for that as well. Those funds are administered under the leadership of the Georgia Department of Behavioral Health and Developmental Disabilities, which is administered by, did I tell you again, my friend, Commissioner Kevin Tanner.
Well, thank you. It's been almost a year since we stood here, broke ground on this wonderful facility to improve mental health services here in Fulton County. And it brings us one step closer to DBHDD's mission of enhancing mental health care to all of Georgians, no matter where they live. This project has been made possible, as you've already heard, by a tremendous partnership between the state and local government. I want to thank all of our legislative partners for their work, their advocacy, their funding, and always their willingness to step up. I also want to thank Governor Brian Kemp and the General Assembly for helping turn the tide on mental health. In the last 5 years since the Behavioral Health Reform and Innovation Commission was created in 2019, we've seen the state increase mental health funding in Georgia, just state funds, by $500 million. That's a tremendous increase. Thank you. I also want to thank my longtime friend, Chairman Pitts, County Manager Dick Anderson. I've known a lot of county managers in my 34 years of public service, but you have one of the finest that I've ever had the opportunity to work with. Fulton County did not just partner with us in this endeavor, but they went above and beyond and extended and expanded the standard that they've now set for the rest of the state. This local investment has been a major reason that this center has been built. This successful collaboration demonstrates the power of local commitment that is a model that we aim to replicate in other areas of the state. Thank you, Fulton County, and your leadership for setting the example. I also want to acknowledge Ms. Tandon, the Director of Domestic Policy Council, for joining us today, for your leadership. And for those of you who don't know, I want to thank Grady. What a tremendous partner we have with Grady. They recently opened the state's first med psych unit, which was funded by the state. through our department, and it is one of a kind in Georgia and really one of a kind in the country. Grady continues to lead, and we're very blessed to have them as a partner in this facility. We all know that recently we conducted a bed study that shows we need 5 additional behavioral health crisis centers by 2025, 3 of those being in the metro area. This is filling one of those gaps, and I'm happy to say the General Assembly appropriated some planning dollars for a second Fulton County BHCC in North Fulton. So there's improvements are happening all around us. So we're excited about what this facility will bring to the people of this community. But we have to remember improving mental health is not a marathon, or it is a marathon. It's not a sprint. It takes time. We have come a long way in the last few years, but we have a lot of work left to do. But I'm confident with partners like Fulton County government, the city of Atlanta, we're going to make progress, and we're going to be the envy of the entire country, because when we come together and we work together, great things can happen, and you're going to get to walk through and see that today. So thank you for being here today. Chairman Pitts, the Fulton County Commission, Mr. Anderson, thank you for the incredible partnership. We've got more work left to do, so let's go get started. Thank you.
Several years ago, and might say many years ago, our team at Grady outlined the behavioral health continuum, recognizing the services that we provided and the gaps that were in the community, where we needed to do more and where we could identify partners to do more. With this framework, we sought to fill those gaps through expansions and again through partnerships. We received support from philanthropy to start our integrated behavioral health, where we meet patients in their primary care setting, identify concerns before they become crisis. That's a huge opportunity for us to start on the front end of the continuum. Of course, through our partnership with Fulton County, we've been able to expand the outpatient access in North and South Fulton for direct behavioral care services, including our medication-assisted opioid treatment programs, both in North Fulton and our Park Place location. But this program has greatly addressed the need for access within the community. As Commissioner Tanner mentioned, we have the partnership with Georgia DBHDD that supported the opening of our med psych facility. We knew that there was a concern on how we were delivering care. The medical component and the behavioral health components were separate. We weren't doing the best that we could. And so to be able to develop that unit, it is amazing, it's beautiful, and we've been able to improve and enhance care for our patients in one place. And then now, as we've stated today a couple of times, we've long known the need for a standalone crisis center in Fulton County. This center will fill a critical void in behavioral health emergency services close to home for the folks in Fulton County. With Fulton's vision, leadership, and the support and guidance from the state, of course funding from both, we'll be able to develop this facility, or we'll have this facility, and then we are fortunate to be able to provide our multidisciplinary team to have the care, to provide the care within the center. This team includes physicians through, again, our partnership with Morehouse under the direction of Dr. Sarah Vinson and her leadership. We'll have nurse practitioners, RNs, licensed behavioral health clinicians, certified peer specialists, behavioral health technicians, and substance abuse coordinators, counselors. We bring expertise from Grady and laboratory services and pharmacy and security and the services that we provide on a day-to-day. We'll bring that here for this robust service to the community overall, leading the care for those who need it most. As mentioned, we'll start with 110 employees. We're so excited to get this underway. Partnerships and collaboration is how this happened. The center embodies those strong partnerships that lead over 130 years and our excellent patient care. We look forward to serving the community and creating the model to be replicated. Now it sounds like sooner rather than later in Fulton, at least 2 more times. But we think that this will be a model not just for Fulton, but for across the state and probably the region. We'll look beyond that. Lastly, again, I want to thank directly the partnerships, Dick and Sharon, who brought us into this, Latrina and Dr. Rochelle, who worked with us day to day, arm in arm, and I certainly want to thank my team, Ann Hernandez and Sue Sweat, for their leadership in behavioral health. Of course, we've got lots of Grady folks here today, but we're so grateful for all that they do.
At this time, I'd like to bring my beautiful friend and colleague, Miss Latrina Foster. Those of us at Fulton County, when the board passed their resolution back in 2021, letting us know they wanted to build a center like that, most of us had no idea what a crisis center was. It sounded good, we were in for it, but Latrina really is the person within our team who shared that vision, helped us see it step by step. Ms. Foster, please join us and tell us a little bit more.
Thank you, Jessica. Thank you to everyone. I'm standing here today because of the county manager, Dick Anderson, who trusted and believed in me and gave me the opportunity to put the Department of Behavioral Health on my shoulders. If I didn't, my name is Latrina Foster. I'm the director for the Fulton County Department of Behavioral Health and Developmental Disabilities. It has been my honor and privilege to serve in this role. A lot of work, but I embrace it because I have a strong team that stands right behind me and we're in it together. And our latest logo is that girls on fire for the women on my team and for the men on fire. So we're fired up about the future of mental health in our department. And so thank you, Commissioner Tanner. We look forward to embracing and walking the journey on implementation number 2. So I ask my family to continue to be patient with me as I take this journey. One significant thing that we need to realize is that we're standing on a campus called Fulton County Health and Human Services at Oak Hill. The word oak represents strength and endurance. If you think about the word hill, it represents elevation. So if we think Oak Hill and what we are attempting to establish here, let me rewind, not attempting, what we have established here, right? The first standalone behavioral health crisis center in Fulton County. You can clap, as Commissioner Kajiji said, you can clap. But we placed the facility on a campus that represents strength and endurance. On a campus that is elevated because it says heal. So the expectation is that the individuals working in this facility will deliver elevated care. And this campus will cultivate an environment of strength and endurance. And when Jessica chose a butterfly, wow, it just all folded in together. Because as we said earlier, a butterfly represents new beginnings. And so through healing, we get new beginnings, a fresh journey. So Grady, my friends, we have a charge to heal. When people walk through this door because they have 24/7 access, they will receive healing and care, which will equal recovery. So before I go any further, I cannot continue without representing or calling up my colleagues that helped me stand here today, that made it possible for all of us to be here today and cut a ribbon to open a door to a 24/7, 24-bed unit, 16 observation chairs, and not one, but 2 living rooms that are safe spaces for this community. Sam Bakari, Tim Diamond, if you could please just come and stand with me because without you guys, I wouldn't be here. Mike Tomlin from Hogan, our construction crew. We have Lily, Carlo, please come and stand with me. You guys were so patient as I was trying to figure out these little lines. What does this mean? Oh, it's a wall. It's because of you all. Ann Hernandez, Sue Sweat, please come up. From Grady, it's because of your activation team, which also includes Anita. So if Anita is back there, I can't see if she's back there. Please come and take a bow as well. And I can't forget my state partners that made it difficult for me, but we're doing it together. So Jennifer Ryback and her compliance team, please just come up and take a bow. Dawn Peel, her operations team, if you're here, please come up and take a bow. Our TBS partners, that helped us with the design to ensure that every single thing in this facility is anti-ligature. No one will enter this facility attempting to receive help, and we place them in danger. So I thank TVS if they're here as well, but definitely Tim and Sam, thank you guys so much. Thank you all.
Good morning. Now, this actually started 5 years ago, not just 3. And Mr. Chairman told me that I had 10 minutes per year. Is that right, Mr. Chairman? He said 10 seconds per year. So there will be no rehearsed remarks. And everybody that's been recognized, I won't rehash that, but I want to just do a couple 3 call-outs. I want to start with Commissioner Tanner. He's a friend. He's a leader. He started the journey in Georgia for behavioral health reform and then took over the implementation. Not many people do that, Commissioner, and I appreciate you. Let's give Commissioner Tanner a huge hand. I also want to recognize our entire board, because without that seed funding, as he said, this project would not have gotten started and wouldn't have been done in the time frame that it's been done. So to our Board of Commissioners, let's give them a hand for their vision and leadership. And again, there are many partners that have already been. I want to call out LaShondra Burks. I want to thank you for any time that we called the City of Atlanta. LaShondra was there. She helped us. There's all kinds of things from zoning approvals to other approvals, and I want to thank you personally for your partnership with us. Give LaShondra a hand. And then we recognized all the staff. Just a couple of people that are not here. John Halpert from Grady, again, a tremendous partner. We worked closely with them. Chairman Pitts and I just within the last 6 months went to a ceremony at Grady where we signed a new 10-year agreement with Grady in partnership. This was probably not only first out of the box of many things that we do together, but they responded immediately. So to Shannon, Ryan, Ann, and that entire team, and John, a huge thank you and a round of applause for Grady one more time. And then finally, back to our state partners. Senators, thank you for being here. A special call out to Speaker Jan Jones, who's not here today, but without Jan's leadership, we would have not had this funding in the budget. She fought for it a couple of times over, this year successfully, and again, more to come based on what the commissioner said, so we're very, very thankful. All that being said, reminded of the quote from that JFK actually made famous about success has many fathers and mothers, but failure is an orphan. I think this is representative of that. This is a huge success, more to come, and again, we're excited and again, very, very thankful. So, Mr. Chairman, I think we're ready to start the ribbon cutting.
1, 2, 3.
Yay!